one important thing is a lot of parents aren't sure if their baby is warm. If the baby has a fever within the first 30 days of life, take them to the ER. You don't want to mess around because there could be an infection that the baby received postpartum. You will still have bleeding, sometimes bleeding up to 6 weeks. Your period may not start right away. Sometimes it may take a while for your milk to come in. You may not be in the mood for sex, so you may have to tell your husband or your partner to hold off a little bit. And postpartum depression. Very, very common. Don't be embarrassed by it, but because of your hormones and the lack of sleep and the stress that happened during the pregnancy, it's very, very common to get the postpartum blues and possibly depression. Any of these feelings that you could feel sadness, depressed, irritable, not bonding with the baby, please talk to your doctor. It's common and it's treatable.
Well, from a obstetrical standpoint, things that we're going to be watching for is fever. Any unusual fever, any severe pelvic pain, any problems with excessive vaginal bleeding, depending upon the route of delivery. If it's a vaginal delivery, did the stitches, could they be getting infected? If it's a cesarean, could the abdominal incision be infected? If you're breastfeeding, sometimes you'll get a mastitis or an infection in the breast, which can give high fever. So pain and fever, bleeding, those kind of things would be the things that we would watch for. From a baby standpoint, obviously, I recommend they touch base with their pediatricians as to whether the baby is doing well. But from a maternal standpoint, in the first few weeks afterwards, the bleeding should be settling down. You should be able to ambulate and move around without undue amount of pain. And again, it depends a little bit on the delivery process, but you should be able to watch for those kind of signs.